Good morning. Welcome everyone. Well, I'm here this morning at the Colorado Department of Public Health and Environment in Pueblo County, and we are presenting another educational series in our prevention efforts. I am Libby Stout. I'm an addiction psychiatrist, and I'm going to be talking about smoking, vaping, and COVID. And this is a very hot topic and stuff that people really need to know about. So we thank you for joining us, and I encourage you to ask questions. So at any time you have a question, you can use the chat box and you can ask questions. And at the end of the presentation, I'll try and answer all your questions. All right, so let me get started here. I wanted to start with, why do people vape or smoke anything in the first place? And the answer is, it's the fastest way to get the drug to your brain. So this is the best designed drug delivery system known to man. If you think about it, if you eat a drug, it takes at least 20 minutes to get to your brain. And you know that if you've ever had a headache and you take some Tylenol, you're not going to get any relief for at least 20 minutes. If you shoot a drug, it takes 15 seconds to get to your brain, but it still has to go through your liver. So it goes in your bloodstream and then it goes through your liver and then it ends up in your brain. If you smoke a drug, it only takes 6 seconds to get to your brain because it bypasses the liver. It goes in your lungs, to your heart, to your brain. And that's why smoked drugs are the most difficult to quit, because they're the most reinforcing immediately. This is also leads up to this problem if you think about marijuana edibles. A lot of people that have smoked marijuana and get that high like right away think that's going to happen with edibles, and it's not. And that's why edibles can be kind of dangerous. If you eat one and then, well, 5 minutes later you don't notice anything, so you eat some more, and then you may have gone too far. So I want to explain how the lungs work, because our lungs are amazing. We have this really amazing capacity to function and survive because of the design of our body. So one of the very important parts of our whole airway system is the airway system, even up in your nose, down through your trachea, into your bronchi, are lined by these hair cells. Now they're microscopic. They're called cilia, or hair cells, and they're constantly moving. So they're moving to keep things out of your lungs. So they catch dust particles and they move the dust particles back out into your nose so that you can snort them out. And we don't like those dust particles because bacteria and viruses sit on those dust particles. And that's how they can get into your lungs, is through those dust particles. But if you have these nice cilia that are working, they can keep it out. And then deep down inside your lungs, you have all these millions of air cells. And they are the ones that are exchanging oxygen and carbon dioxide. So this looks like you could see it, but you can't see it without a microscope because there's millions of these cells in there. And they're one cell air sacs, and each little air sac is surrounded by capillaries. And so when you breathe in oxygen, oxygen immediately goes into the bloodstream, and carbon dioxide leaves the bloodstream and goes out into the environment. So we depend on oxygen, and plants depend on carbon dioxide. So that's why we have this symbiotic relationship with plants. And so you want to have a lot of plants around that are producing all the oxygen you need, and they love having you breathe out because you breathe out carbon dioxide. And that's how we do this gas exchange. And then all these capillaries and this whole little alveoli are surrounded by elastic tissue that then, so most of your expiration, you don't even pay attention to. You may do a deep inhale, you fill your lungs, and then your air cells squeeze out the carbon dioxide. So a lot of the carbon dioxide is leaving without you even doing anything. So that is an amazing system. Now, this is just a picture of somebody coughing. And if you ever thought about it, you see somebody cough and the sun is shining through their cough, you can actually see their cough. That's because what you're seeing are the dust particles in the air. And you can look in any out at window, you know, the sun's shining in, you see dust particles in the air. So we have dust particles in the air all the time. So when somebody coughs and they have an illness, like a bacteria or virus, it can sit on those dust particles. And then if you walk through that air, you breathe in those dust particles. And that's why we have these things with COVID, with masks and social distancing. So I really like this one because it's a really good description of this. If the person on the left has COVID and coughs, the person on the right, 90% risk of getting sick. Now, if the person on the right is wearing a mask to protect themselves, the mask is somewhat protective, but not that great, especially cloth masks. You know, you need to have those N95 masks, but those are only for the hospital. If the person that's sick or has the virus and may not know it, but they wear a mask, then that person without a mask is less likely to get it. And then if they both have masks, there's only a 1.5% risk that somebody's going to get it. And then if you add the social distancing, which is the 6 feet, there's a 0% risk of transmission. So how is this drug delivered in this system? This is really fascinating, I think. The drug sits on top of the aerosolized tar. So if you see smoke in the air, that is basically aerosolized tar. It's little tar droplets, like the dust particles, but it's little tar droplets. And the tar droplets are smaller than dust particles. And the drug that is being delivered sits on top of the tar droplet. So that tar droplet is small enough to get past those cilia, those air cells, those hair cells that are trying to keep dust particles out. So you suck in a big inhale of smoke, and this is also true about vapes. The drug being delivered is sitting on top of that. So it goes directly to your alveoli. The drug goes directly into the bloodstream, just like oxygen. But the tar droplet can't get into the bloodstream. It's too big. And so it sits there and fills up the capillary. So it fills up the air cell. And it fills it up. So what then happens is, over time, this tar is really corrosive. If you think about it, it's not much different than the tar that's on the ground. It can eat through things. And the tar is from the plant material. So tar comes from the tobacco plant, it comes from the marijuana plant. Excuse me, it can be very corrosive. And over time, now it takes a long time for tobacco to do this to people. It usually, most research shows that you're not really going to start seeing kind of consequences like this until you've been smoking for 25 years. But what happens is your air sacs fill up with tar, your lungs turn black, and the air cells start breaking down. So you used to have all these little one-cell air cells that are breaking down into bigger ones. And now the connective tissue the elastic tissue can no longer squeeze and allow the carbon dioxide to leave. That's how you get air trapping. So you breathe in oxygen, it goes into your blood, the carbon dioxide comes out of your blood, but there's nothing to squeeze it out, so it goes back into your blood. And when you get too much carbon dioxide in your blood, you can't think, you can't function, you can't function. And that's why people have to go on oxygen when they have emphysema. So this is the way emphysema happens. And it's directly related to smoking. It's directly related to tar filling up your air spaces. And this tar is, like I said, very corrosive. And what it tends to do, it tends to line the cilia of your airways. And it causes the cilia to lie flat. where they don't function anymore. So you have a bunch of black tar lining your airways. You don't have the protective mechanism anymore to keep dust particles out. This is why people that smoke are much more likely to have bronchitis, pneumonia, bacterial infections, viral infections, because you no longer have that hair cell protection because of the tar. And then, like I said, the tar basically will turn the lungs black. And then that can lead to cancer, because these are all carcinogens in here that then can result in people getting lung cancer. There are many, many chemicals in a cigarette. I just want to go through some of these. Carbon monoxide is a big one. So I already talked about oxygen and carbon dioxide. Those are two things that we have normally in our body. Carbon monoxide is a toxin that comes from pollution. It comes from exhaust out of your car, and it comes from smoking. So it comes from smoking a cigarette, from smoking marijuana. And carbon monoxide is very dangerous. It's one of the things that leads to heart attacks, and it causes the lining of your arteries to be more susceptible to having plaque formation. So carbon monoxide is measurable. And so if you ever try and quit smoking and you go to a smoking cessation clinic, they often have a carbon monoxide tester where you can blow in it and see how much carbon monoxide is coming out of your lungs. And in the normal environment, like Pueblo, it's pretty healthy because there's not a whole lot of pollution here. You're normally going to blow between 0 and 5 parts per million of carbon monoxide. If you're a smoker, like you smoke a pack a day, you can blow 20 to 45 parts per million, which is much higher than anything OSHA allows in a house. And so it's kind of like the equivalent of putting your mouth on the exhaust pipe of your car and sucking in heavily. That's what you get from smoking a pack of cigarettes. Now, there are things like arsenic in there. Ammonia is in there on purpose by the tobacco companies, because nicotine has to be absorbed in an alkaline environment. This is why if anybody's ever tried nicotine gum, they tell you to just chew and park it. Don't chew it and swallow it, because if you swallow it, the juices, it gets into your acidic environment of your stomach and it's never absorbed. So it has to be absorbed through your oral mucosa, and it has to be alkaline. And so the tobacco companies put ammonia in it on purpose to increase the absorption of nicotine. And there's all these other potential things that you can find in a cigarette. And this is similar to marijuana. Marijuana is just not THC or CBD. There are many other things. There are tars in marijuana, just like in tobacco. There are solvents, especially if you're smoking the high potency stuff that has to go through butane hash oil extraction. So you're going to have that kind of things. But we're also finding there's fungus, there's mold, there's pesticides, there's herbicides, there's fungicides. These are all things that can be found in marijuana. And then the e-cigarettes, they were developed, the electronic cigarettes were developed theoretically because they're going to be safer. That's what everybody thought. But it's turning out that they are not safer. They're not safer at all, because they contain a lot of the same things that cigarettes and marijuana do, such as heavy metals. That's another thing about marijuana, that they have a lot of heavy metals. It's the beauty of the plant. The plant is a wonderful plant. So you can put a hemp plant in a place like that's a runoff from a mine where there are toxic chemicals, and the hemp plant will suck up all of the heavy metals out of the soil. So you can clear soil by using hemp plants. But the problem is then all that toxic heavy metal is in the plant. And so that's something to think about. But we have these in e-cigarettes as well. And a lot of people, especially kids, say, oh, well, I'm only smoking the flavor. I'm only smoking, the bubble gum or whatever. Well, the flavoring agents in there have been linked to serious, serious lung disease. And so what we are seeing now, like I said, it takes 25 years maybe for smoking cigarettes to start affecting your lungs. We're seeing this within a year. Vaping is affecting people's lungs and killing people, which is really scary. So I don't know if you knew this, but I think, Juul is a very popular way of using an e-cigarette because it's very small, no vaporize that you can really see. It's very easy to use. There is the equivalent of 20 cigarettes in one Juul. So if you think I'm just smoking one Juul, you're smoking a pack of cigarettes. And then there's all these other things that can cause cancer and cause serious effects on the lungs. And Juul actually knew that they were putting out this product that was highly potent. And it was advertised to young people. So they knew this. And some of the engineers actually devised a kill switch on the Juul that would decrease the amount of nicotine a person could get from it. But the idea was shelved. So the company is not taking responsibility for this. And so we end up having problems like this. And I encourage you to look at this website. It's a video of this young man. He was an athlete and was not really smoking very much with a vape pen. And he developed such serious lung disease, he had to have a lung transplant. And so when you look at a lung x-ray, it's supposed to be all dark where the healthy lung is, because you're supposed to be seeing air. And so it's all dark. If you see on the picture on the left, that was his lung picture when he needed a lung transplant. They had to put him on an ECMO machine, which basically takes the blood out of the heart and lungs and puts it through a machine to keep him alive before they could put new lungs in him. And then he got new lungs. So this is about that flavoring agent. So you think you're just smoking bubble gum, or there's all kinds of flavors that they think are so wonderful. This has been linked to severe scarring of the lungs. And if you think about it, that gentleman who works in the industry is filling up this flavoring agent, and he's wearing a gas mask. I mean, he knows that this is dangerous. And they expect you to then smoke it, and it will affect your lungs. This is a case, another 17-year-old, this is in Canada, who basically was vaping flavored e-liquids and then THC. And he ended up having this problem, which they're calling on the x-ray, it's called tree in a bud. And it's very difficult to see if you're not used to looking at x-rays. I'm a psychiatrist, so I'm not used to looking at x-rays. But this is showing that people are not doing well, and they've actually been quite a few deaths, young people. So just getting back to COVID, if you are smoking or vaping, you're putting yourself at much higher risk for getting this virus. And so I recommend that, and what we're finding is if you get the virus and you're a smoker or a vapor, then you have much higher mortality from the COVID virus. And this is mainly because you get secondary bacterial infection, and then it's worse and worse. And so, the recommendations are wear your mask, social distance, 6 feet, and then don't smoke or vape. It's not just the lungs that are affected, and I'm not going to go into this very much. I just think this is kind of fascinating to think about. Both nicotine and THC increase your heart rate, so they also affect your cardiovascular system. And this is why we already know that nicotine is highly related to heart attacks. I mean, we know that for an absolute fact. we are starting to see the same thing with THC. And so this is just showing the difference between smoking THC and using it in a vape, and your heart rate, and depending on the milligram dose that you just smoked. And so the blue line is somebody who isn't smoking. Well, they're smoking, but it has 0 THC in it. They don't have any really change in their heart rate. Then the 10 milligram has a significant increase, but the 25 milligram has an even more higher increase in your heart rate. But I think it's interesting to see that vaping causes it even higher than smoking. So there's more and more data coming out about marijuana and its cardiovascular effects that can be negative. So now is the best time to quit. And I just want to point out that there are really great benefits of quitting smoking. Because even after 20 minutes of your last cigarette, your blood pressure goes down, your heart rate goes down, your hands and feet get warmer. Now, if you smoke again, because most people smoke at least 1 hour because they're in withdrawal, that all goes right back up again. But if you wait for 24 hours, your heart attack risk is lowered. After 8 hours, your carbon monoxide level returns to normal. So you're getting all that carbon monoxide out of your system and your blood oxygen levels go up. After 72 hours, it's much easier to breathe. And most people notice that. And I found that when I work with people trying to quit smoking, the first 3 days are the worst. They're the hardest, the most difficult. You get past those 3 days and it starts getting easier and easier. It says here, after 48 hours, your sense of smell and taste starts to improve. And that is one thing that people notice when they quit smoking. They can start tasting their food. One thing that's not on here, but I've absolutely seen it, I know it's absolutely true. Within 30 days of quitting, your hair cells can be back to normal. And so that improves your risk for infection. But you have to wait like those 30 days of quitting. And I've seen a lot of people who tell me, oh no, I'm sicker now that I've quit smoking. And I said, well, how do you know? Because I'm coughing up black stuff. So, well, you're coughing up that tar. And most people don't notice that because you cough and swallow, cough and swallow. But if you spit it out and it's black, you should say, oh, good, I'm getting rid of the tar. That's a good thing. So after a year of quitting, your heart attack risk is cut in half. And after 10 years, your lung cancer risk is cut in half. So there's great benefits to quitting smoking. And for those of you who have not started yet, there's a great reason to not start. Now, this is a sad picture, but this is the reality of smoking. And it seems to be worse in women than men. And of course, women value their looks more than men do. But it really affects the elastin in your skin. Like I was talking about the elastin in your lungs, but you have elastin in your skin. And when you smoke, it decreases that effectiveness ability. And so you start getting really bad wrinkles. And we do know that tobacco is the #1 cause of death compared to all these other things. And yeah. Women are much more likely to have a heart attack because of smoking than men. And even smoking just 1 cigarette a day can increase your risk of heart attack 50% and stroke 25%. So a lot of people say, oh, well, I'm not a problem. I'm only smoking 1 cigarette a day. But if you do it every single day, that's compulsive use, and that's a sign of addiction. I don't know if this is a true picture, but you know, you can see these are twins. Supposedly one was a smoker and one wasn't. And then there are lots of kids that think, oh, well, it won't be a problem if I just try it. They're showing that if kids, you know, just do this 1 time per month in the 6th grade, 53% of them end up becoming heavy smokers or dependent smokers. And 40% became daily smokers in the next 4 years. So think about not doing this at all until you're in your 20s, if you're going to do it at all, because the adolescent brain is just the worst time to try and put this stuff in there. And I just like this because this is back in 1994, which isn't that long ago. And these were the executives of the largest American tobacco companies, and they were testifying in Congress, raising their right hand and saying, "We swear nicotine is not addicting." I mean, that is amazing. And so we're having the same thing happen now with the cannabis industry. And people want to say, well, cannabis is not addicting, but it is very addicting. And the problem is when you're using it as an adolescent, then you're really risking serious brain damage, which can affect people's cognition, problems with making decisions, and then increase the risk of psychosis. And people having, bad psychiatric experiences. It also then can prime the brain for other substance use, harder drugs. And then we also see this now more and more and more. And this really could be a talk of a whole nother talk, because this is something that is totally related to the addictive potential of the higher potency marijuana, because this has always been around. There have always been people that had idiosyncratic reactions. That means it's not supposed to happen. Marijuana is supposed to help nausea, vomiting, but some people have the opposite effect. Well, so it's always been around. Even I just saw somebody say that it was reported back in 1100 in some text in the Middle East. However, it's been rare until recently, and now it is flooding the emergency rooms because it requires somebody using on a regular basis to get this to happen. And what causes people to use on a regular basis is the higher potency drugs causing more addiction. So people are using on a regular basis, and they end up getting this, what's been coined scromating, because it's very painful. So people come into the emergency room screaming and vomiting. And they get these complete workups trying to figure out what's wrong with them. And oftentimes it's missed that it was due to cannabis because they're not asked the right questions, they don't volunteer the information, or people are not using during doing drug screens. It's very difficult to control, and the only solution to this is to absolutely quit. Like, you have to quit. And there are Facebook pages now that are really wonderful support groups. I recommend people look into them. So if you just put in the search engine cannabinoid hyperemesis syndrome, there are many Facebook support groups, and more people are having this issue, and they're very supportive of each other because they do help people realize that the only solution is to quit. So what we want people to do is to have alternatives, as opposed to trying to get into this drug scene that's only going to go bad. It's going to go the wrong way. We want to see people trying other things to get natural highs. And so I just point this out. Iceland has really come a very long way. They used to have one of the highest rates of adolescent drug and alcohol use in the world. And they just made a total turnaround. They got family members involved, they got the community involved, and they started doing things to help engage kids that would engage them in activities. And they have had a significant reduction in all of alcohol, marijuana, tobacco use, other drug use. And we have a similar thing in Colorado. It's very active in Boulder, and I encourage people to look at this website for Natural Highs. They're doing a lot with adolescents, trying to help kids see that they don't have to use drugs, they can do all kinds of other things and feel really good about themselves. All right, so that's my talk on the topic of the day. And so I'm happy to take questions. Okay. All right. Well, we have some questions here. And feel free to put in any other questions you might have. Let's see. Okay, isn't vaping just water vapor cleaner than cigarettes? Shouldn't I use the lesser evil? Okay, well, that's initially what everybody thought, but as you saw in my presentation, it's a lot more than just water vapor. There is an electrical coil that heats up, but there are chemicals in there, and the chemicals are very damaging to the lungs. What is the addiction level difference between THC, nicotine, and alcohol? That's a very good question. All right, the most addictive of those three drugs is nicotine. THC is rapidly catching up, and it's because of the higher potency. You know, back in the 60s, 70s, 80s, it was like 2% THC. Now the average in the flower is 20% here in Colorado, and people are smoking the concentrated forms like wax, shatter, dab, and they're getting up to potentially 95%. And that's creating more and more addiction. So the latest study I saw was the people that were using on a regular basis, 30% were addicted. Alcohol is the most used drug, and it is the most abused drug because it is the most used drug. However, most research demonstrates that even though up to 90% of the population may have used alcohol at one time or another, only 14 to 15% of the population actually develop alcohol dependence. Nicotine is the one that causes the most, and it's about 34, 35. It depends on the studies you're looking at, but like I said, THC is getting on up there. So that and as I said, the smoked forms of the drugs are the most addicting. So that's because it gets into your system so fast. Should I share my vape or joint with COVID-19 still being an issue? No. No, please do not share anything that involves exchanging bodily fluids when you don't know what that person has and you're wanting to stay away from them. I don't smoke, but someone close to me does. Am I at more risk for COVID-19? That's a really great question. And you know what? We don't know. We don't have the research yet to really demonstrate that. However, we do have a lot of research on passive smoke and the effects of secondhand smoke and thirdhand smoke. And we absolutely know that secondhand smoke can contribute to cancer. So if somebody is living with somebody their entire life, never smoking themselves, but they're surrounded by it, they can still get lung cancer, and it's because they've been exposed to it the whole time. So my thought is that most likely being around smokers does increase your risk for COVID, I would think. But we don't know that absolutely. It's just that we know that when there is smoke in the air and the drug is on the tar droplet, it is in your body, whether you want it in there or not. And that's basically how we got smoking out of airplanes, because if you remember, or if you were around when you could smoke on airplanes, everybody had to be at the back of the plane. So everybody would walk to the back of the plane and smoke cigarettes. And they did a study where they did like a 3-hour flight, and they took everybody in the front of the plane who was a non-smoker, and they had them pee in a cup before and after the flight to do a urine drug screen. And they found that the people that were non-smokers had enough nicotine in their urine as if they had smoked 3 cigarettes. So it's in the environment, it's in your body, which means it's in your brain, and it's in your lungs, and it's wherever you don't want it to be if you're not doing it. Okay, so how do people tell the difference between COVID-19 symptoms and smoking symptoms? Well, that is a really good question, because we can't at this point. If you'll think about it, all that stuff on eValley, so that's the electronic vape associated lung injury, that was last year. So there was all this stuff coming out about eValley and how it affected the lungs. And the lung pictures look just like the COVID pictures. So here we are now in 2020 with COVID, and it's very difficult to tell the difference. And so this is why I'm hoping people are collecting data, on, are people smoking? Are they vaping? Are they using marijuana? Are they using nicotine? What are the flavoring agents? What are they using? And I'm not sure that's happening. I hope it is. I hope anybody who's hospitalized with COVID is getting those questions, and that they can be put into a big data system and we can start understanding this. But, what we do know is from China, we found that there were reports of higher incidence of COVID in smokers, and higher incidence of problematic things, and it was also much higher in men, and that is because in China, I think 70% of the men smoke. I'm not sure, that can't quote me on that, but I know it's pretty high, and very few women smoke. And so this is something that hopefully people are collecting data on, and I hope we're learning more about. Let's see. How do we educate youth about the dangers of vaping and marijuana when adults are using it at high rates? Yeah, that's true. That's a problem. And so that's why we want to do things like this. Hopefully we have kids listening, because I'm amazed how kids can influence their parents. I mean, I am amazed what kids learning in school, and of course that's difficult right now too, but kids learning things and can tell their parents, why are you doing this? Why are you doing that? When this is, and so if people are, the more we can get out the information, the better. But a lot of kids are using because their parents use. That's absolutely true. Let's see. I vape when I'm stressed at my job. What are the other ways I can relieve stress other than vaping? Okay. Yeah. Okay. That's a whole nother talk. Let's see. There are many, many, many ways you can release stress. But one of the things you have to understand is you're not relieving stress. You're relieving withdrawal. Because the withdrawal is causing you to feel bad. This is why nicotine is so damaging. I mean, it's so addicting. That's why it's the worst one. Because if you're addicted to tobacco, like nicotine, you usually have to smoke every hour. Because during the time you're smoking or vaping, the level of nicotine is rising in your system, but it's only there for like 5 minutes, and then it's falling off. And withdrawal to any drug is exactly opposite of what the drug does for you. So if that one makes you more focused, makes you more relaxed, makes you feel good, it's all going to be the exact opposite coming off. So you basically think it's helping you de-stress, but it's not. You're just treating withdrawal, and you won't know that until you quit. And like I said, the first 3 days are the absolute worst. And this is where you can use nicotine replacement, like gum or patches or things like that. Some of the research shows that cold turkey is the absolute best way, but it's the hardest way. Because once you get it out of your system, then you know what your level of stress is. You have to kind of do that to know what your level of stress is. But in the meantime, you know, you can do things like deep breathing, tapping. There's all kinds of videos you can get on the internet. If you look up emotion freedom technique, it teaches you how to do tapping, which can be very relaxing and stress relieving. Yeah, so I first encourage people to quit, to find out what their real stress level is, and then work on techniques. And let's see. Why worry about marijuana and vaping when we have an opiate problem in our country? Well, we have both problems, yes, and we worry about all of them. I think that there's a lot of research linking marijuana to opiates, and that is the topic of a whole nother talk that could be addressed here. And yeah, I think we have to worry about both of these problems. And then there's a question here. Why is managing pain with over-the-counter medications safer than marijuana? I'm not sure it is safer. It depends on how you do it. You know, there's problems with everything we put in our body. And so, yes, there's over-the-counter Tylenol, Motrin, Aleve, different products that should be used intermittently. They shouldn't be used constantly all the time. And we just don't have enough research on marijuana to know that it really is helpful. But if you look at the research on chronic pain, the chronic pain research shows that there is some benefit with neuropathic pain from marijuana. But if you look at the research, it's on doses less than 10 milligrams or less than 10%. You can't even find that in the dispensaries right now. We've got this high potency stuff that is not been studied, and we don't know that it helps with pain. In fact, there is some evidence that when you get into the higher percentages of THC, you actually have hyperalgesia, which is what we see with opiates. This is why opiates are not the treatment for chronic pain. The longer you take them, the less they work, and then you end up having more problems. So similar to any addictive drug, you use it more, you develop tolerance, and you start having withdrawal. Withdrawal is opposite of what the drug does for you. And so I think that, you know, using over-the-counter medication sporadically is a good thing, but there are still things I think that you have to do this with your physician, depends on what your pain issue is. And there are other alternatives that are really helpful. I've found that acupuncture is a really helpful thing for chronic pain. Massage is a really helpful thing. So there's alternative things that have no side effects that are really, in my opinion, the best way to go. If that's all we have, then thank you for joining us, and we'll see you again later.